Spring is here, and you know what that means? It's time to get those winter blues dusted, mopped, and wiped away.
That's right.
That's right. And here to talk about it is Dr. Mina Murram, a friend of the show. Thanks for joining us again. He's a neurological and psychiatry physician and assistant professor at Columbia University Medical Center. So to jump in, spring cleaning, we all know it probably makes sense to do it. You kind of feel good after you do it, but what are specifically some of the actual recognized health benefits of getting in there and cleaning your environment?
Absolutely. Just as we were talking, there's the general idea that, hey, this is a chore. I don't know if I really want to get myself to do it. But I think if we can see that there is a sizable increase in our performance, our anxiety being reduced, and our sleep being better, that can say, well, you know what? This might be worth approaching because there is real mental health benefits to every small step I can take. I don't have to do it all at once, but it can make a huge difference for us.
And something interesting I came across in doing some research for this is that actually doing the cleaning can make you feel better, or at least reduce your anxiety. So there was a study in the British Journal of Sports Medicine saying 20 minutes of cleaning can reduce stress by 20%. It's nice to put a number on it, but I don't know what you think about that.
It's absolutely true, because if you think about this, imagine you and I are talking right now, and in the middle of us trying to get our own conversation going, we're in the middle of New York City traffic, and there are all these cars kind of bobbing and weaving through. There's a lot of things that could be competing for our brain's attention. So when we're able to just say, hey, I'm gonna just do one thing at a time, and I have a sense of order and control around me, that gives me a sense of calm, a sense of peace, and the brain will reinforce that by releasing more dopamine and saying, you know what, we're gonna lower anxiety, we're gonna lower stress, because now we feel like things are in control.
So you mentioned dopamine, and I'm really interested in the connection with that. I think we all know that, you know, if you do something that makes you feel good, you don't really think about the chemical aspect of that. So could you explore that and how cleaning could actually invoke that?
Absolutely. You know, neurochemically, the brain wants to be able to give us a reinforcement that what you're doing right now is a helpful, good activity, and dopamine is one of the ways to do that. With cleaning in particular, because we're seeing that there's a sense of our order and control, and because there's a sense here of saying, you know what, I have my attention not diverted into 100 different places, but focused into one particular area, the brain will be able to say, do this, this is good. And because there's always the question about motivation and the actual activity. This is one of the things that we talk about in behavioral activation. We don't want to always wait for the motivation to have the behavior. Sometimes the behavior itself will produce more motivation. That's what the brain will release more of those feel-good chemicals to say, did the behavior, good job, do it again.
And I do want to get to how we can step into that before we're motivated. But first, I want to talk earlier, you mentioned that the visual clutter can also kind of contribute to mental clutter, and
Yes.
studies certainly back that up. You could speak more to that.
Absolutely. You know, the visual clutter, or another term for it is sort of visual pollution that we think about, right? Think about, again, the analogy if we're having a conversation and there's 15 people behind me competing for your attention, whispering a word or whispering a thought. The brain wants to be able to take in a limited amount of input. So when I have a whole lot of visual input in front of me, the brain is saying, do I interpret this or this or this? What do I want to take in? By limiting it, by saying, you know what, all we're focusing on is this cup. All we're focusing on is this clear surface and this task. That helps the brain not have to compete with all these different kinds of things, different stimuli. And that visual decluttering now will allow us to have less mental clutter as well.
Now, we've been talking a lot about the mental aspect of how cleaning helps your mind. I want to jump in, and I know that you talk a lot about the mind-body connection, but
Yes.
let's talk specifically about the body now and the lungs. The American Lung Association says dust is something that you really need to be mindful of. So, you know, you don't really think about, you know, that there could be dust actually impacting your breathing and how you feel. So can you explore that a little bit?
Absolutely, especially around this time, my patients will say to me, well, I'm not breathing quite as well. Is it my allergies? Is it my air quality at home? And that study that is being referenced is saying, well, are we paying attention to the air quality at home? Are we making sure there's fresh air? Are we making sure there is good, some even aromatherapy that we're incorporating there? Perhaps a humidifier, perhaps something that can make sure the air that I'm breathing in every day in my home space is as good of a quality as I can possibly have it. That can really go a long way, and we may not think about it unless there's a motivation to say, hey, every quarter or so or every spring, how is my air quality at home?
And specifically cleaning, though, like vacuuming and mopping and, you know, going behind the corners, is that going to really affect how we breathe?
Definitely, because what we're seeing is a lot of times when we're leaving surfaces the way they are, you know, things just pile up, you know, from dust mites to the way that, and all of that will impact the air quality, right? And unless we're regularly making sure all of that is taken care of, well, we won't even realize, oh, how come I'm coughing a little bit more? Why am I not breathing the way that I would sort of want to be? But we'll notice that difference after sort of a cleaning segment that we have.
Talking about things piling up, there's also this aspect of the risk of falls.
Yes.
The CDC saying 1 in 5 falls causes serious injury, such as to a person's brain or even broken bones. So if you could talk to people out there who may be more at risk of falls.
This is huge, both for folks who are maybe in the caretaking capacity for an elderly parent. That fall can be devastating. You fall and break a hip, that could really increase your mortality risk. So one of the ways to prevent that is just to make sure our walkways are clear, to make sure that our pathways, steps, stairs, especially going to the bathroom if you have to get up in the middle of the night and go use the restroom, just doing that and having that fall prevention, we may not realize that's associated with spring cleaning, but that can lower your risk of death substantially when you lower that risk of falls.
So there's this study that I find interesting. It was published by Psychology Science, and it showed that people who worked in an organized area were twice as likely to eat healthier food options. What's going on here?
Yeah, absolutely. Here's the thing. Whenever we're thinking about an organized area and how that helps our productivity, how that helps our decision-making capacity, oftentimes when everything is piled up, we reach for what's closest. We reach for what's nearest. We just do the least amount of work because, again, the brain is overwhelmed. It's saying, look at all the things that are coming my way. But when there's a bit of an orderly space and I can say, you know what, I'm going to make a conscious choice to reach for the healthy snack, as opposed to everything is coming at me so fast, I'm reaching for the chocolate bar.
You know, I want to talk about sleep next because that seems like a constant question for most people, how to get better sleep, right?
Yes.
And apparently, according to the National Sleep Foundation, people who wash their sheets regularly, say once a week, actually report 19% better sleep. Fascinating.
It really is. Between washing your sheets, making your bed, things that we hear when we were young, and just realizing there's a big impact to just having your sleep space be sacred. What are the ways that from a sleep hygiene standpoint to making sure that it's clean, it's orderly, it's cool, temperature-wise, all of those things have a direct impact on the quality of my sleep. I just sometimes think I'm going to jump in bed and I'll do the best I can to have good sleep, but the more I can prepare that space to make it clean, clear, cool, the better my sleep becomes.
Now, it doesn't seem like cleaning would be considered exercise, getting your heart rate up. And if your heart rate's up during cleaning, it must be a pretty intense session. But I mean, can people like skip a workout in favor of, getting the chores done?
Well, that's the thing, is that you can make this a more engaging, fun activity, and it can be somewhat moderate exercise, because if you're looking at all around the house and you're setting a timer, say, for a particular period of time, and I'm going to really be moving, and I'm going to go from one place to another. I'm going to make sure that I can go, if there are steps, I'm going to go up and down the steps, that I'm going to engage my full body into this exercise. And it doesn't necessarily replace a workout, but it can be a good way for me to just keep moving. And that's a great step forward.
Maybe it makes you get through the task a little faster too, right?
That's right. The less we can think about it as a chore and the more of, hey, this is something I'm going to enjoy, there's health benefits, I'm moving, I'm exercising, the better it is, that the more likely we are to do it.
That's so brilliant, actually, because it totally transforms you the way you think about it. It's more like you're thinking of it as a treat, like going to the gym.
Yes.
You're treating yourself well.
Exactly.
You're investing in yourself, which, as we've heard, it really is that way. But even so, it can be so hard to get it done.
Yes.
Do you have any tips for people out there really feeling motivated, but maybe wondering how to take that actual first step to getting it done?
Absolutely. Motivation is sometimes very challenging because we're just overwhelmed by the sheer volume of what has to happen. Whether this is the physical decluttering or even reflecting personally and saying, how can I declutter unwanted thoughts or feelings or grudges? Those are things that we talk about as well. And the biggest tip that I share with patients is we want to go systematically and small and system-wise. Small, set a timer for 15 minutes and say, I'm only going to work on this desk. I'm not going to work on the whole house, but if I have a small amount of time and I have a clear task, by the end of that 15 minutes, say, oh, that's a great sense of accomplishment that I've had there. And then after that, there's 3 really basic things that I share with patients, which is take what you have and say, what do you want to keep? What do you want to contribute, meaning donate? And what do you want to clear? You want to move that out of your life, whether that's a thought or what's an item that's unwanted that I've just been hoarding for years.
And quickly as we finish up, it seems like the household chores are a source of conflict with most families. What's a suggestion to turn that around and make it maybe a source of teamwork or pride?
Yeah, a couple of things that I've tried with patients is one is making it a bit of a competition. Say, all right, for the next 5 minutes, we're all going to, especially if you have younger children, that could be a sense of, all right, for the first person that can do this, here's a prize that's coming. Or that we're all going to be doing it together. Oftentimes the conflict is, you go over there and you fix this while I'm over here on the couch, just enjoying myself. But if we're in it together and we're making it fun and we're making it even a bit competitive, that can go a long way.
Well, every time you come into the show, I feel like I've gotten healthier, I've gotten stronger, I'm a little bit more adjusted going into the weekend. So we thank you for joining us
That's
today.
the goal. Thank you so
Thank
much for having
you.
me.
Yeah.